I want to say thanks to all the nurses, doctors, and first responders, and everyone else fighting this crisis in the front lines. I appreciate everything that you're doing. Before we dive into today's clinical corner, I want to introduce you to Annie. I'm here with Annie, our clinical RN, and we're going to just talk about traveling during a crisis. Annie, why don't you tell me, what are some things that nurses should consider when taking a crisis assignment?
First of all, Karina, thanks for having me today. Before taking a crisis assignment, we always suggest nurses interview the facility and the candidate, the client that they're going to potentially take an assignment with. So before taking that assignment, we want you to ask some key questions, and that would be, what type of resources are available in terms of supplies? As far as the N95s, the gowns, gloves, surgical, procedural masks, and in regards to all of their supplies on hand and how they manage those supplies. In addition, what is their current workflow? And that can be surrounding their staffing ratios, call patterns, those types of things. Many of those things have been altered now due to the staffing crisis we're going through. So some of the commonality ratios and resources have changed quite a bit during this crisis time. In addition, you want to ask about the support staff. Do they have CNAs? Do they have transport people? What will be the resources in regards to staff for you? As well as you want to inquire about employee health or occupational health. Do they have an on-site employee health or occupational health there in regards to if you do have an exposure or have a health issue while you're there on assignment? Some additional questions you'd want to ask, which I feel like we'll get into later, is in terms of floating and other expectations. But you certainly want to inquire about your benefits as well as what type of insurance that you're carrying while you're going on these assignments.
Okay. And can nurses bring PPE to their assignment?
So for our company, we are not advocating that. With the shortage of personal protective equipment, there are many different companies that are advertising their products on the internet, for example, N95s. And we want people to note that the N95 masks must be approved by the National Institute for Occupational Safety and Health, which NOSH is their acronym, to be used in a healthcare facility. And a lot of these current advertised masks are not approved by that entity. So our policy now is that we do not want travelers to provide their own PPE attire. It also opens up to a liability in case the products are ineffective as well. So we encourage you to follow the guidelines of the facility at your assignment.
Okay, thank you for answering that. And as far as nurses goes, when they're traveling, can they refuse a COVID or high-risk patient?
So at this time, if you are clinically qualified to care for those patients, meaning your work history and your qualifications, as long as the facility has the proper PPE according to the CDC guidelines, you cannot refuse to care for any patient types. There are some exclusions. We do have some travelers that do have accommodations from their personal physician that state why they could not care for them, and those were also taken with exception. But overall, you are expected to care for those patients as long as they can safely keep you in the proper PPE attire.
Okay. Now, going on to the topic of floating, what if they ask to get floated to a different unit?
So in regards to floating, if you are not qualified clinically in terms of your work history, meaning if you're an ICU nurse and you've only worked in the ICU, you cannot float to, for example, labor and delivery or ER and take a patient assignment. You would want to check with your agency, but as far as our agency, we do not advocate that patient assignment being assigned to nurses that are not qualified. And that would mean that you would have a year of experience in the last 3 years caring for that population. So if that's not the case, however, we know that we're in a staffing crisis, we are allowing travelers in most circumstances to float to areas where they task, meaning they can answer call lights, assist with other duties in regards to patient care without being assigned a patient assignment and a charting responsibility for those patients.
Okay. And what if your traveler is exposed to COVID-19 while on assignment?
That's a great question, Karina. And if a traveler is exposed while on assignment, the first thing you want to do is notify your manager or supervisor at the facility, and they will inform you of the facility's policies. Most likely, they're going to refer you to their employee or occupational health for guidance in regards to that exposure. As the CDC guidelines have changed, we've seen a kind of a difference in regards to how these situations are handled. Originally, everybody was being asked to quarantine for 14 days and monitor their symptoms. However, moving forward, contingent on what policies the facility has, in certain cases, if people are asymptomatic, meaning without symptom, they are in some cases being returned to work with monitoring their temp twice a day and being mindful of any symptoms. And they may be asked to wear PPE while they're there on assignment. However, if they do become symptomatic, then they will be quarantined as far as monitoring their health. In addition to resources, if the client or the facility is not able to provide you with as appropriate or additional guidance, you can certainly reach out to our agency. And in addition, you can also reach out to the Department of the County of Health in the county you are in. They have 24-hour hotlines that are very informative on what you need to do to monitor yourself and follow guidelines.
And what are some good additional resources for travelers to look at for reliable and up-to-date information?
Great. Two good resources that are constantly updating their information and are readily available for most people are the CDC website, the Center for Disease Control, as well as the FEMA website, the Federal Emergency Management Agency. Both of those are constantly importing the latest information in regards to PPE, attire, and how to handle exposure situations, as well as just general information about keeping yourself safe in the workplace.
Well, Annie, thank you so much for being a guest today. I appreciate your time and for answering all these questions.
Oh, Karina, thanks so much for having me. Have a great day.